My name is Mary Mahoney. I am a radiologist. I'm a physician. I am the department chair of the University of Cincinnati Radiology Department. And I am the chief of imaging for UC Health. So 2 different roles, 1 job, 1 person. And the way that works is in medicine, in an academic medical center as opposed to a community hospital, we have 3 missions. 1 is education, 1 is research, and 1 is our clinical mission. So education means that we're training the next generation of physicians. Medical students, we call them residents, where they're subspecializing, and then fellows, where they're super subspecializing in not just radiology, but in one area of radiology. So we have an educational mission and we have a research mission. Around research, we will tell you that today's research is tomorrow's practice. So what we're doing today that's under the research realm or umbrella is what's going to translate into clinical practice, better methods of taking care of patients in the future. So those are my missions under the college side of what I do. And then under the UC Health side, our clinical mission is to take care of our patients, to do the best high quality patient care with best outcomes. I'm also involved in a number of national boards. So my involvement in radiology has been not only locally in Cincinnati, but I felt very compelled to get involved with what's going on nationally and even honestly internationally and globally with radiology. So I'm on the board of governors for the American Board of Radiology. That's the organization that certifies physicians and says, yes, you're qualified. Yes, your training is adequate. Yes, you are now board certified and can go out and practice. I'm involved with the RSNA, which is the Radiology Society of North America. It's the largest medical meeting. It's a huge society, and it's very internationally, globally oriented. American physicians and the quality of medicine that we practice is just astronomical. It is so incredible and so beyond what many other countries can do. RSNA has a global outreach where we are partnering with physicians across the world to try to improve patient care. So last week I was in Japan. Next week I'm going to Brazil. 2 months ago I was in Vietnam. The year before that I was in China. I go all over the world trying to train physicians to do what I do and to interest them in improving the quality of patient care in their countries. It's enormously rewarding. I'm getting emotional. Edit this part out. Wow. Okay, and then I also work with the American College of Radiology because medicine in this country is really complicated. So there's all these issues about reimbursement and what does the government pay for and what does insurance pay for and what should patients, what proportion should an employer take on as the burden? What is the patient's obligation? Should everybody get everything they want all the time? Do we need to limit resources? Who decides? How do we decide? What do we do? And so the American College of Radiology is more the advocacy, the lobbying, the working with government, working on reimbursement, working on regulations related to insurance. And then locally, just dealing with this huge department. I have 90 radiologists. We cover CT, we cover MR, we cover ultrasound, we do interventional, we do catheterizations, we do nuclear medicine, we do mammography. It's a huge department with hundreds of thousands of patients. It's just a lot. It's a lot. It's really exciting. It's really interesting.
That's what everything is.
Yeah, it's a lot.
It's a whirlwind of emotions.
It is. It's a lot of stuff and a lot of work. It's exhausting. It's exciting. It's interesting. It's always interesting. Always interesting. Yeah, I am fortunate to say that's my life, because I'm not sure everybody else in the world would tell you that they have an exciting, interesting, awesome, incredibly great job. And some people would say, no, life is dull. Life is drudgery. And I don't say that.